What's up, YouTubers? This is Dr. Steve from Elevate Sport and Spine coming to you again to talk a little bit about planking today. I know a lot of people know what planking is and how to do it, but I just wanted to go over some of the more common mistakes that I see people make, a couple of modifications for it if you feel like you can't do it well, and a couple of progressions that you can do if it feels like it's getting too easy. So planking is a really great exercise for teaching us a good foundational movement, which is how to kind of keep our posture in good alignment while we're using our arms and legs. So you can use this to kind of build up to other things, but I think it's a great place for most people to start. I usually recommend people hold them for anywhere between about 20 to 30 seconds at the most, and then taking about a minute between and maybe doing 4 to 5 of them at any given time. So not a ton of it, you don't have to hold it for tons and tons of minutes at a time, but there is some indication that people that hold the plank for about 2 minutes or so tend to have a better overall musculoskeletal health. So maybe it's a good goal to aim for is to be able to do a 2-minute one. But I'm just going to show you a couple of things to do, cues to remember when you're trying to do planking, and how to modify it in a couple different ways to train your body a little bit differently. So the most basic plank is the one where we're facing kind of face down here like this. And the easiest way, what we can try and do is kind of plank from the elbows here. The thing that we really want to make sure that we're doing is not letting that low back sag to where we're kind of getting our butt sticking up in the air, because it can put a lot of pressure on the low back and cause more pain, which is the opposite of what we're trying to do. So I would just try and make sure that when we're down here that we're keeping a good tight low back, that we're feeling our belly button drawing towards our spine, that we're not feeling this sagging. We can make sure that we're keeping that in alignment by squeezing our glutes and then holding from there. If this one feels pretty easy, the next progression to go up to is to keep your feet off the ground. Same idea, we want to squeeze the butt, we want to push down into the ground to where we feel our shoulders engaging, and then draw that belly button in. We also want to make sure that we're not kind of letting our head hang, that we're trying to keep our chin kind of tucked back just a little bit there like that, okay? So from that point, the next way we can make it harder is to do this kind of high planking position here. Same cues that we want to do is try and keep those shoulder blades in, make sure that we're not letting the back sag by pulling that belly button in, keeping it flat and not pushing our butt up in the air, and squeezing those glutes, and lastly doing kind of a Kegel maneuver, which is where we can kind of squeeze the muscles in our pelvis to kind of like, it's kind of like you're trying to prevent yourself from peeing. So you want to think about kind of holding that while we're doing all these things so that we're staying nice and tight. So that's a pretty basic way to kind of do a plank, and the cues that I would look for. If you feel any pain or anything like that, then try and reduce yourself back down to the more basic types of planking. From there, things that we can do to make it a little bit harder are to start doing these kind of leg lift maneuvers here like this. And then we can add an exercise ball into the situation and do these kind of planks from here like this. And we can do what are called stir the pots, where we can kind of go back and forth through here, go side to side, and even little circles from one way to the next. And then from there, we can do these kind of guy here like this, where we're putting our feet on the ball instead and trying to hold here. And once we've gotten pretty good at that, we can start introducing this kind of piking maneuver here like this. Okay? So these are great kind of modifications and progressions of the plank for face down. Other ones that you may want to add are a side plank here like this, where we're holding it up, being made harder by coming up onto the shoulder here like this. We want to make sure that hip is not sagging down. We can make it even harder still by doing a leg lift and coming up here like that. And then the last one that we can do is this kind of reverse plank, where we can make sure that we're kind of pushing those shoulders up towards the ceiling, pulling that belly button back, squeezing those glutes, pinching everything down, pulling that chin back, and pressing through here. So there's a few different types of plank things that you can do. Hopefully it can help you out with some low back pain. I know it helps some people. So give it a try. If you have any questions about it, hit me up here at the clinic. Until then, we'll see you next time. Take care.